Yeah. Oh, yeah. Yeah. No, my semester starts again in 3 weeks, you know.
Yeah. Well, yeah, so does mine. That's where I'm like, okay, TikTok, let's get this done.
Yeah. Yeah.
But
Yeah.
you
You know,
know,
I
the
have my
nice,
last student today, and in 3 weeks we start again. And oh, by the way, do 10 hours of interviewing in their spare time. Volunteered, of course.
we're about to do our mannequin swap out. So we report back. They are finally delivering the mannequins. You know, we've been waiting since May.
Wow, nice.
Well, we've been on standby all summer, like waiting for like when are they coming? So they're officially coming in the second week of August.
I
So
got a new mannequin yesterday.
we have 15 mannequins coming.
I know. I only got one. He doesn't even have a face.
Oh no, faceless mannequin.
He's
Um,
special.
I know I need to reach out to Nikki because as soon as they get packed up, because our Junos are all going to Nikki at Northern Caribbean. So I got a
Yeah.
message from her on LinkedIn like, do you still have them? Like she's worried like I haven't heard anything. I'm like, no, they're still safe. They're in my lab. I tucked them in the other day. I saw them.
Oh, that's awesome for her though.
Mm-hmm. Yep.
She's wanting a TNCC course there.
Oh, is she? Yeah,
Yeah.
I hadn't talked to her in a while.
Yeah, she talked to me. Well, when we did the faculty training, I
Mm-hmm.
don't think I included that in there. When we did faculty training, I invited them to come for our 8-hour faculty training class.
Well, I knew you said she had a couple faculty that they
Yeah,
did.
yeah, yeah.
I when I was at an Excel, I saw a poster session out of Michigan,
If
and it
I,
was a
I start.
research study inquiring about Caribbean universities through Panho and level of training. So I had expressed an interest and gave my card. So I'm actually going to be meeting with them next week virtually because they're looking at establishing some training for facilities that you are either getting a mannequin, have a mannequin. It's at very early stages.
Yeah, yeah.
Because I had said how I was down in Jamaica in January, and you know, she has an uphill battle.
It wasn't like a beach vacation.
It was not. Virtual is my friend because she is nowhere near that airport.
Mm-mm.
But Lewis is actually in Virgin Islands right now, opening, helping with some center opening.
That's so cool.
We haven't started on broadcasting,
Okay.
just in case.
Okay, that's 5 o'clock.
Yeah.
It's 5 o'clock somewhere.
Hello. If people starting to join in, wonderful.
I'll show my cup. It's 5 o'clock somewhere.
5 o'clock somewhere. Okay. We'll give a couple minutes to let everyone log in and then I'll introduce you. So if you need to take a quick break before we get started. What do you think, Mariano? Should I start introductions?
Sorry, I'm muted. Yes, please go ahead.
Okay. Well, welcome to our July's meeting for the Florida Healthcare Simulation Alliance. This month, we are fortunate to have Ms. Carla Brunk, who's with the James A. Haley Veterans Administration Hospital. She's going to be presenting on mobile simulation, what's up at the BLAINE A MARKEE Advanced Simulation Center. And we're really honored to have her. So she's going to start her presentation.
Hi, everyone. I've been working with several people here for quite some time. I believe since 2015 is the first time that I taught with June, and we've been collaborating ever since. So you're going to see a lot of things we've done over the years there. Let me get sharing my screen here. I'm just going to stop my video so that I can get your presentation started here. And sorry. Get it open. That'll make it easier.
You still have to hit screen share screen.
I got you. She's a coming.
Okay.
And then there she is. And let's just go from the beginning, huh?
Yep, now we see it.
All righty.
There we go. Thank you.
You are welcome. So I was asked to give a little presentation on simulation. A lot of people come from the academia side of simulation. I come from the hospital side of simulation. So a lot of our work is done because something happened at the hospital that could have really went south quickly. And we want to teach the staff so that it doesn't happen again. So we kind of go from that modem. This is our facility. So I work at the James Haley VA Hospital Center. It's in Tampa, Florida. We're across the street from USF. And on the left is our polytrauma spinal cord building. And then on the right upper is the main old building right behind the water tower. And then on the right bottom is the brand new bed tower that's getting ready to open. So what do? So we take care of veterans. That is our goal here. We are part of the federal system, and our mission is to honor the veterans, provide exceptional health care that improves their health and well-being. And so our whole motto is to care for him who shall have borne the battle, and for his widow and his orphan. So we take care of our veterans. This is their hospital, not our hospital. And so this is kind of a rundown of what we are. So our main hospital, the older hospital, is 415 beds, and the new bed towers, and our 415 beds includes 4-bed ward rooms currently. And so we are moving into the new bed tower with 136 private rooms. We are so excited for that to happen. We also have a community living center that's attached. All these buildings are attached to each other. You don't have to go outside. So the community living center is like the nursing home, and that has 118 beds. Our spinal cord unit is 96 bed, and 2 of those are long-term units. We have patients there that have been there for probably 12 years. Then we have a traumatic brain injury and rehab and chronic pain, which is another 66 beds. We have 2 acute recovery, which are our psych units. And then we have the DOM, which is considered our outpatient drug and alcohol rehab program. It's in the hospital, but out of the hospital. And then we have what's called community-based outpatient clinics, or what we call our CBOCs. And so I work in nursing education, and this is the people that I need to educate in these areas. So that's where my workload comes from. So our simulation program utilizes any department in the facility. And so I listed several of them, but we have great interaction with our hospital. So everybody comes to the sim lab to learn. This is our main simulation lab part with our mannequins, my best friends. And so you can kind of see the layout. We have 3 really big rooms that are multi-purpose. So just so you have an idea of what we've got going on here. So this is a multi-purpose room. All of our rooms have wheels on the tables so we can move them in and out. That's our storage area behind it. This is our RQI. So we are just transitioning over the last 2 years to RQI, which is the quarterly resuscitation for BLS and ALS. And it's been a significant improvement in our mock codes. We're in our regular codes. We're seeing a much higher skill level when we see codes now when we go to audit them. So we just last year had our first fellows at the James Halley. So the top left picture in the green scrubs is Dr. Christopher Gaines, and then Dr. Joseph Nadler is in the front there. The bottom left is a picture of the mock code. Dr. Joseph Nadler's project incorporated the need to use CO2 on all codes, like that is one of your primary vital signs. And we didn't have the connections on our simulator to actually incorporate that. So he literally figured out if he held this tube next to him being attached to a CO2, that he could make his CO2 35 to 40 if he held it at 12 inches, but if he held it at 16 inches, he could make it 30 CO2. And so his code improvement project is what it was. So it was a very ingenious way to incorporate CO2 into codes. Dr. Christopher Gaines decided to do the central lines. His project incorporated doing a pre-confidence survey. Then he taught them how to do the central lines. These were residents that were just coming in. And then he brought them back a month later and had them redo the clinical skill of central line and then do a post-confidence survey. It was really interesting results. They were very confident afterwards. So it was really a good use of our fellows. So this is the sim bus that June wanted to know if I would talk about. So this sim bus is actually a 30-foot dual use vehicle, or a DOVE. The military uses acronyms for everything. And it's used for disasters. So it's actually not a sim education bus most of the time. We slap that sign on it when we're not in a disaster. So this bus was developed after Katrina because they recognized they didn't have a way to get the patients out of the hospitals going through water and different challenges. So this bus was designed, it has it can go through snow, it has some change you can put on the tires, it can go through 5 foot of water, the way the exhaust is made, it has its own generator, it has air conditioning, and we could actually live in the bus for 3 days with HEPA filters without being contaminated in there. So it was very well designed, but it does not have a bathroom. It has a, if you can picture a Home Depot bucket with a toilet seat on top is the bathroom. So I'm not sure I want to do that for 3 days. Just saying. So this was originally what the DUV was. When we got our first DUV back in 2016, they were like, we really need to be practicing with it because we work for the federal government and we have to honor the 4th mission. So we went ahead and we were able to use it in a really unique way. I'm going to try and play a video. So if I lose you, I will come back to you. And see if I can get to it. All righty. Well, let's see if I can pull it up from this way. Sorry. Sorry about that.
I figured it was probably a tornado and just figured the best thing to do was to get somewhere safe. The only thing I could think was to go to the bathtub with the kids, and I just made them all huddle down in the tub and hold on.
In October of 2016, Hurricane Matthew left a path of destruction from the Caribbean to the southeast U.S. with widespread flooding, storm damage, and power outages affecting over 1 million people. Meanwhile, the Department of Veterans Affairs, staff, and resources from around the nation were sent to VA facilities in flooded areas of North Carolina to help meet the medical and social service needs of veterans there. Fortunately, the southeast coast was spared a direct hit by Hurricane Matthew. But what would happen if it wasn't? How would a community respond to a hurricane that could devastate its city and demolish everything in its path?
Essentially, the scenario for this exercise, which is called Sunshine Endeavor 2017, is a Category 5 hurricane that hits or makes landfall in the state of Florida, west of Palm Beach County, and it goes across the state.
Exercise Sunshine Endeavor was held in early June of 2017 in West Palm Beach, Florida. Triggered by what could have happened with Hurricane Matthew, it tested the capabilities of the VA and the local community to collectively respond to a catastrophic Category 5 storm dubbed Hurricane Thomas.
The 4th mission of the VA is to provide medical care to civilians and responders in a time of disaster. This is in addition to our daily business of providing care to veterans. During a disaster, we are required to be able to provide to both of those.
For the VA, it also tested its important 4th mission, being prepared to answer the public's call for help.
Building coalition.
All right, excellent. We have Jennifer over here. Do you mind having a seat, Jennifer?
Their job was to assess and treat those affected by Hurricane Thomas or to arrange to transport them to where they could get the help they needed.
This exercise is important because we need to be prepared, totally prepared for whatever might happen with the weather in the whole state of Florida and southern Georgia, which we represent. So we want to be out there prepared, ready to help.
Sunshine Endeavor 2017 was definitively a total success. We were able to bring partners from all across the region to play together in the same sandbox. We were able to identify lessons learned that we definitely want. Once we address those, will enhance our resiliency and our capabilities to really respond to hurricane events and to really work with communities in providing continuity of patient care.
Officials agreed a lot of important lessons were learned that will help the VA and its surrounding communities to be better prepared for the real thing. Sunshine Endeavor, partnering with the community prepared to respond, providing a roadmap for the future.
All right, so go back to my other share screen. I am looking for my other screen as we speak.
I think you have to reshare screen. I think you discontinued it.
So I stop and then I start again.
Yeah, I think somehow you got out of it.
I'm not the most fantastic Zoomer, sorry.
You're doing great.
Oh,
There you go. Now we see you. See the screen.
There we go.
I shared that with my husband as well. We are very much in disaster management. Type
That's
stuff.
awesome.
So he came in to watch too. Thank you.
You're welcome. Okay. Now I'm back. Can you see me okay now?
We can see your screen, yes.
Cool.
Perfect.
I'm so excited now. All righty. So the reality was when we got that beautiful DUV, we actually got like 3 of them because other facilities really didn't want them because they come with the obligations of being prepared for emergencies 24/7 and having to take your staff and go to those places. So here in the sim lab, we were asked to develop, it was just supposed to be 40 sick people, and could I design like the inside of the tent so that we would know how I would like it set up. And so it went from 40 scenarios that I was supposed to develop of sick patients to 60, and then it ultimately became 120 patients. My most favorite patient that was triage, we had some awesome moulagers there, by the way. My most favorite patient was when I got the patient who came in, and I had written the scenario, so of course I knew what was going on. She had lost her insulin and her blood sugar was 347. But she was carrying the box of Dunkin' Donuts that they had down at the thing for the volunteers. And I just laughed because it was so awesome. It's like, now that's taking that whole picture to the next level. So she got the best award. So we want to say, well, it was really cool education. And a lot of the students that volunteered during that really loved the idea of coming on the bus and getting triaged, and they were asking us all kinds of questions. I'm like, wow, this bus just sits over here in the locked gate area waiting for a disaster. And we have students that we could go out and educate on this bus, and they obviously love coming on it. So we decided, well, why don't we do some disaster management training for our CBOC fellow employees? And so we literally developed a set of scenarios so that they could come on the bus and triage them and, learn about sorting and triage other than just that disaster training that we get in a book, and that went really well. So then we thought, well, we'll see if the students would like it. So we partnered up with the University of Tampa in their community health portion. And so they get the didactic learning from the University of Tampa, and then they get to come on the bus and they get to triage patients. So it worked out fantastic. So it's boring just reading stuff, watching these PowerPoints. I'm a hands-on learner, so that's what I wanted to offer to them. So of course, in the emergency readiness process, you have to discuss the triage. You have to talk about critical thinking skills and how are we going to get them to clinically reason and hopefully improve their clinical judgment at the end of it all. So we always, we use the START method to sort our patients on our bus. And so it's a very simple algorithm. We have a 1-inch binder, and literally it's laminated pages. We used to give them a paper handout that they could take home, but with COVID, we had to come up with some way that we could still train, but be safe. So we laminated them, we put them in books, and then we just sent the PowerPoint to the instructor so they could upload it to whichever course they wanted to upload it to. So then they got to have the best of both worlds. So this is kind of the inside of our bus. And we have a scenario of 7 mannequins that we moulage. I've written probably 4 sets of scenarios now because I kind of like to change them every time we go somewhere. I like to kind of update and what's the newest thing out right now. So they come on the bus and they take turns moulaging, and I got a little video, so I'll let you see that and you'll understand it better. So this is the 3 amigos. That's what we were called in West Palm. So we actually came up with the scenarios and made the hospital tent and everything. So they called us the 3 amigos. So these are my cohorts that helped with everything. So I'm going to try and go to another little video for you. And let me see if I can find my other screen again. Sorry. And so I'm trying to exit that one and go to this one.
Emergency bus used for simulation through our disaster emergency management program. This sim will actually be used for teaching, which we use it for today. But if a real disaster would happen, we can take the mannequins off in less than an hour or 2 hours and have it report to wherever the disaster is. This disaster bus was actually made after Hurricane Katrina. It's a dual-use vehicle that can withstand 4 feet of water or snow and go through. It can travel within 625 miles with a full tank of gas. You can do surgery on the bus. It's got many outlets and generators, so we can plug in as many like IV poles, and it's got oxygen tanks so that everybody in the bus can have oxygen if they need oxygen. It has 17 litters, and it also has 32 seats, so it can transfer a lot of people. After Hurricane Katrina, they realized that people still needed medical care and they needed to be transferred, and they didn't have that type of luxury for transportation. And that's why the government made...
I'm just going to move it along a little bit because we already talked about all of that. So let's go about here.
Here we are at the sim bus. Let's climb aboard and see what we have in here.
Okay, let's go.
here's our mannequins, and here's our litters, and here's our seats. Okay, so we're gonna do some training today.
On Black Friday 2022 at the Tampa Premium Outlet, shoppers were waiting in lines when gunshots were heard. People started falling to the ground. The shooter opened fire near Starbucks and sprayed bullets into the open door. People started screaming and running to hide behind anything they could to shield themselves. 911 was notified. Currently, there are 25 victims who have already determined that 18 of the victims were triaged as green. Today, your group will triage the remaining victims to determine what resources will be needed. We're going to start with scenario 1, which is right here. You guys are going to work together as a team to identify what triage level the victims are. Scenario 1 is a 32-year-old female sustained gunshot wound to the abdomen at mid-torso. She is unable to walk and can follow commands. Respirations are 32, heart rate is 87, blood pressure is 82/57, and she is A&O times 3. Please go ahead and proceed.
Okay, is she able to walk?
So she's unable to walk and can follow commands though, but she cannot walk.
Okay, does she have spontaneous breathing?
She has respirations at 32 breaths per minute.
Okay, let's see, how's her perfusion?
Her heart rate is 87, blood pressure is 82/57, which we consider clinically low.
And I'm going to check her capillary refill. And I'm going to do that. Come over here. I'm going to do her capillary refill. Okay. And it's, is it less than 2 or greater than 2? Greater than 2. Greater than 2, okay. And basically, and her respirations are 32, so that's greater than 30. And so then basically she's then going to be category red. Yes, because she's got this abdomen. You agree with that? Yeah. Yeah, I think she's going to be a category red. Thank you, team. Okay, let's move on to our victim number 2.
Victim 2 is a 21-year-old female who sustained a gunshot wound to the top of the head. This person is unresponsive and hemorrhaging. Respirations are apnea. After repositioning of airway, patient still apneic. Heart rate is 41. Blood pressure is not palpable. Cap refill is greater than 2 seconds. Unable to follow commands. Please work as a team and triage your victim.
So this patient is not breathing, and they repositioned the airway, and she's still not breathing. And even though she's 21 years old, I think we should label her as expected black. Yes, which is unfortunate.
Oh, all righty. So, let me see if I can get back to my other screen. And so one of the things that so there's 7 scenarios like that, and they have to go through them all. The one thing that I find the most compelling for the students is really having to come to terms with, they just made a person who's 21 years old, they're not going to do anything for them. Whereas if they were in the ER, that would be the first person they would take care of. And so really comprehending that use of resources and understanding that medical staff are resources. They aren't just medical staff. How many people would it take to work on that 21-year-old, and how many other lives will be lost while you're working on that one? And that's it can be really tough for the students to kind of come to terms with, but it's really excellent for them to do that. So these are some of our students. I'm going to pop through some of these pictures just because I love my students. And so this is the SIM bus. It doesn't only just do our disaster training. We actually go out to do Stop the Bleed. And this was at the MacDill Air Show, which is kind of nice. There's some perks there because we got to watch all of the airplanes come and go. It was kind of cool. And a lot of people came through the bus, and a lot of people were introduced to Stop the Bleed. So hopefully our society will be a lot safer with the 4th mission. And so this is the staff that were there that day. And on the right, there's a really cool task trainer. On the left, it's that big thigh that has a tourniquet on it. But on the right, you'll see a little tablet that's on the table. And it's actually a little tablet where you can take that tablet, you actually pack the wound with the gauze for about 30 seconds, and then you have to hold pressure, and you have to keep the line above adequate pressure for another 30 seconds. And it takes a lot of pressure, and then they actually get a score. So they use that score as a competition a lot when we do like the middle schoolers. We went out and did some middle schoolers, and they'll actually repeat the tourniquet and the pressure so that they can get a better score to beat their friends, which I think is phenomenal. We actually have in Pasco County, we went to the school system headquarters, and we taught all of the health professionals at the headquarters how to do stop the bleed so that they could have classes. And there's actually stop the bleed equipment in the Pasco County schools, at least one unit per school now, which of course with the gun shootings the way they are nowadays, tragically, it's really needed. So one of our principals actually wrote us a letter to let us know that he was not going to let any of his 8th graders leave his school without completing the Stop the Bleed training. And I thought that was spectacular. So some of our other simulation stuff we do, we have a lot of interprofessional education, because we are in the hospital setting, and that's how we work. We don't work in silos. We all work together. So currently, most of our simulation that we're doing for interprofessional is actually activation time trials, which you consider in the 4th mission, mitigation, because we want to know how long it's going to take us, because the new bed tower is actually going to have the 3 ICUs. However, surgery is staying in the original building. So we want to know how long it's going to take us to get an open heart patient from the original building over to the new building. And we want to know how long it's going to take us to get the crash cart from one end of the hall to the other end of the hall, and where the crash cart should be on each unit in the new building. So that's what we're doing currently with activation time trials. And we literally put one of our mannequins in a bed or put our mannequin in a wheelchair, and we like rush through the building. So, and the new building is much more secure than the old building. So you have to stop and put your PIV card. And it's amazing how much time that takes. So we've learned some lessons already from doing that. We also do mock codes. We do mock codes here in the sim lab, as well as we wheel our mannequin up to the hospital beds. And any department, it's fair game for any department or any C box. We've actually taken our mannequins over to the C box and actually had a mock code there as well. We do cold stroke. We have a transition to practice here at our facility. So the nurses are in there for the first year. And so we always want our nurses who are brand new nurses coming into nurses to experience a code stroke and a mock code before they have to experience it in practice. So we actually bring our transition to practice staff come down, and they usually are with the new residents that are coming in for training, and we do that training with both of them. Currently, we're doing an OR alert where we have the OR staff will go over to the cath lab to actually help with that training. Then we do rapid response training. We could be anywhere in the parking lot with our mannequin. And change of condition, medication interruption, and suicide prevention, and COVID-19. So those are some of our interprofessionals. This was an activation sim that we had to do for mitigation when COVID came. So we literally moved part of the emergency department to the parking garage. And we literally had to run activations in the parking garage. How long would it take us to get? So they did their triage in the parking garage. And then they sorted the patients from there who came to the hospital, who stayed in the parking garage, kind of like an urgent care, and then who went to the COVID ER. So we literally split our ER in two. So there was a contaminated and a non-contaminated. So a lot of sims doing those. And it worked very effectively for over a year. This is the OR. And as I said, we do quarterly, we have to go to the OR, and we actually have to do fire in the OR. And I believe we're using dry ice in a little bucket under the stretcher now to make it look like smoke before we call it. So, you know, realism's very important. So it really helps them. Safe patient handling. So we are a no lift facility. The most we're supposed to lift is 25 pounds. So every employee comes through safe patient handling class. This is actually our classroom. And that door in the back that says elevator really is not an elevator. That's from one of our other trainings. It's actually from our escape room. So, but this is a safe patient handling lift, and they do their hands-on with pushing everybody around with different lifts in this department. And then we go over and we work with the simulators. And so for the sake of time, I'm not going to play the video, but I was just telling June that this is our newest mannequin. It's Mr. Hardy, and he's actually 400 pounds for real. And he came in a crate, and we in that black lift tarp, and we literally had to use our lift in the sim lab to lift him out of the crate and get him onto the bed. His legs and his arms probably weigh 100 pounds. So the whole premise of getting him, and the gentleman in the right, the blue shirt, is actually our emergency manager, Travis Garrett, and Robert Foss on the left is the paramedic who works with him. The whole premise of getting him was we have to evacuate patients if there's a fire. We currently just opened a bariatric area and are going to be doing much more bariatric work and surgeries and stuff. And we felt like, yeah, it's easy to say that you can evacuate somebody down the steps in a sled to go, which is what we use on the right with Mr. Laurel usually. He looks big, but he only weighs 110 pounds. So it wasn't real. So now Mr. Hardy gets in the sled to go, and we literally pull him down the hallway and go down the stairs. And I've learned that you work from the top. You want to be the top person. I'm just going to say that. The bottom person is in control of the patient and the wheels, so that are on the bottom side of that. There is a little video there if you want to look to see what that evacu sled does, how it functions. This is Chris in Lightning. He's actually a simulator that we use for patient education for anybody who's going for open heart surgery. The patients will literally come in, go into a room, just like this is set up, like it's an ICU room, and them and their loved ones will come in, and we will explain every tube, every dressing. They're going to be intubated, and we show them everything that's going to be there when they wake up from surgery, chest tube, Foley, everything. And what we've done by doing that pre-education before they have their open heart surgery is post-op is so much better for them that we've actually decreased their length of stay by 2.5 days by educating prior to surgery with a realistic look if they can get up, they can touch things, they can come over, they can play with the SCDs, and they ask all kinds of questions. And I knew it was a really effective education. We had a patient who went to open heart, and the wife had come in with him to go to the education, and he was actually up in the OR, and the wife brought the daughter who just flew in from out of town down so we could give her the education before her dad came out of open heart surgery. So very, very humbling experience when you realize how much impact our education has on patients. So we do sim challenges, and this is kind of interesting. We do, in this case, we did a suicide challenge with Tampa, Seattle, and St. Louis. And basically every facility puts on a scenario and we learn from each other. So the sim sound, our scenario happens to be suicide, and we decided to do suicide with transgender patients. And there's a really good transgender video that we use to go over the suicide, and those links are in there if you guys want to watch them. I don't want to run out of time for you. This is an ultrasound class that we are doing. So all of the residents come down and do ultrasound. And then this is actually our physicians that are on board. Dr. Pagara is there, and they actually teach each other how to do the ultrasound. So the cardiologists teach the renal, and it's a really interactive simulation. Dr. Park, our medical director, is the person in the blue scrubs on the left picture on the right hand side, and he usually coordinates that for us. This is a COVID escape room. So literally all new employees were going into this escape room when they came in for orientation, and they would literally have to go through this escape room. And basically it taught them how to don and doff and understand COVID. And it was very successful. We're still actually using that, unfortunately. This was a simulation driving the interdisciplinary team. So we actually do what are called changing conditions. And we actually change those scenarios quarterly as well. And our scenarios come from something happened to a nurse or a physician, and we don't want it to happen again. And so we literally do those. So it was an excellent simulation. This is a recognizing adverse effects of medication interruptions, a collaboration with UT. Thank you, June. Simulation between a hospital and a university to empower students. And literally we go in to University of Tampa, and the students are there, and we have 2 inpatients in beds and a poor nurse who's trying to pass medications, and they're making all kinds of noise and racket and carrying on. And she has to go get the pill cutter because she forgot it. While she's gone, a physician comes in and takes the computer out of the room, so she has to negotiate to get that back. Another nurse calls on the phone and wants to go on break. So ultimately the patient ends up hiding their pills and doesn't take any of them. And we go through the students with recognizing what happened in that scenario and getting them to understand before they go to pass medications how important that role is, that we are the last stop before the patient swallows that medication. So it is very successful. This is TNCC. I'm a TNCC instructor. So we don't have a lot of staff. We have a medical director, and then we have the sim director, so Dr. Park and Dr. Janet. I educate in the sim lab, but I am not staff in the sim lab. but I will be the first nurse educator on the payroll in November. I'm very excited about that. So I teach a TNCC course that has 7 different scenarios. So I had to come up with a system where I could get these guys ready quickly. So I developed a bag system, all of their scenarios in the bag, and everything I need to do to make my mannequin ready is inside that Ziploc bag, and I can get them ready in about 10 to 15 minutes by doing that process. And that's literally what I have 2 big carts for them, and we just roll them in and they're ready. So if you want people to come to your sim lab, this is a very helpful way to do it. So we moved down to our sim lab in November, and we wanted people to start coming to train at the sim lab. And so we had an open house, and Dr. Janet made, I believe, 1,000 sugar cookies, and every employee who came got to moulage a sugar cookie, and then of course eat it and take pictures with the staff and on the sleigh. And it was a really awesome open house idea, and they toured the sim lab and all of the different things we have to train with. So if you want to get people to your department, cookie moulage.
I love it.
And of course, we want you to stay safe. So please maintain a safe 6-foot distance. And I hope everybody stays safe in their sim labs. And that's the show for me.
That is awesome. Tell me what TNCC stands for.
So that's Trauma Nurse Core Curriculum. It's through the Emergency Nurses Association.
Thank you.
Carla, thank you for kind of giving us a broad overview of all the different kinds of simulations that you do, because a lot of what you showed, we've known each other for a long time. I didn't even realize all the depth, and that it's not just, what you do with the doctors and nurses. It's going out to the schools, it's going out to the community, and it really does show the broad view of what simulation can do. So thank you for sharing.
You're welcome.
I am going to steal the cookie idea. I'm thinking Sim Week. That is a phenomenal idea for Sim Week.
It's fantastic. And we gave out little prizes for the best cookies. Obviously, those 2 were the best cookies,
I'm thinking that could be a great Sim Week activity.
It's a really good one. Yeah. Does anybody else have any questions?
I can only say that I'm deeply impressed with all that the VA hospital sim labs has. And I really enjoyed the video and the sim bus. That's just amazing.
It is. We are very fortunate. But, I will say, emergency management has monies. The federal government has monies. Like some of the Stop the Bleed that we got for the schools came from federal monies. So there are resources out there. We just have to kind of figure out how to do it to get them out there. I know June, we've come over and done Stop the Bleed. And of course, I always use new tourniquets every time I come, because we shouldn't use the same thing twice, and I'm always forgetting them, June. I don't know why I forget those when I leave.
I'm going to put a plug in. From an academic point of view, one of the reasons we have such a great collaborative relationship is my role is to prepare students to enter clinical practice. For me as an academic educator, to know what is relevant in current today's clinical practice is to reach out with partners in clinical practice. So having relationships, if you're an academic, reach out to the educators in the VA, because they have amazing ideas and they're willing to share because it's federally funded. So we've been able to use some of the videos through the VA and build scenarios for our students, so that way they're prepared. They're like the medication interruption system. We've been doing that for years
But I love the
that
way
with students before the first time they ever passed the first pill. So it's giving them that empowerment of what do I do when it doesn't go by the book? We spend a lot of time teaching them the right way.
Yeah.
Problem is the patient didn't read the right way, and the clinical environment didn't do everything in the right way. So if we don't ever teach them what do you do when it doesn't go right, they're ill prepared. They don't know, how to problem solve. So we kind of give them that, and we give it to them in a safe way because they get to observe someone else doing the mistake. They get to call it out. And for our learners, that has been huge because they don't have to be fearful of looking dumb in front of their classmates. They're in the safe seat.
Yeah, and I actually love the period right after the simulation when they talk to us about our careers, and because I try to make sure that I bring educators from every area of the hospital, because every student has a different idea where they want to end up. And it's amazing to me like how enthusiastic they are at like getting to their nursing career, and how grateful they are when you share that you've been a nurse in the ER for 30 years,
And with all the people that are the shortages we have in the healthcare system, the more you expose the younger generation to these careers, the better it's going to be for all of us.
Yeah, I think the director Melissa Colt just did that best project. That video is fantastic, by the way. I just got that one.
We hosted a camp program that's based out of the community for our high school students interested in pursuing careers in healthcare. So we hosted one of the days with simulation. They brought the sim bus over from the VA. So they did stop the bleed and the disaster outside, and then inside we had an anaphylactic escape room, and we had a snake bite, a patient down, and they had to use the escape room. We had how to use an epi trainer as some of our things that we were teaching the students, because we wanted to make sure it was appropriate to high school students. But the advantage was we had physicians, we had physician assistants, we had nurse practitioners, we had nurses, and it really did give that opportunity not just to do simulation, but to see collaboration, to talk to clinical partners, and to see that we can work in the same sandbox, not just disaster sandboxes.
Yep.
So yeah, the more partnerships we have, the better I think we are preparing the next generation.
Yep. Well, thank you for inviting me.
I'm thankful you came out and did this. I know you've been hopping.
Yes, today was the last day of clinicals for my students in the hospital today.
So open up, does anyone else have any questions or anything that they saw that they'd like to ask Carla about with any of the VA programs? Okay.
Okay, thank you very much for the presentation, Carla. On behalf of the Florida's Healthcare Simulation Alliance, we appreciate you taking the time to do that. For the rest of our members, please stay tuned. We are going to have a next one within a month. Okay. Thank you very much.
Thank you for teaching me Zoom. I'm a Teams user. Okay. I appreciate it.
Thank you, Carla.
Bye-bye.
Thank you so much.